IORT, intraoperative radiation therapy, is delivered at the time of doing a lumpectomy, or in medical terms, a partial mastectomy for breast cancer. The key with using this technology is patient selection and following the guidelines that have been set up nationally by an organization called ASTRO. Now, it does take some time to deliver intraoperative radiation therapy. So once the surgeon gets done performing the lumpectomy and checking the sentinel lymph nodes, typically then the equipment is brought into the operating room. And so part of the time that it takes to do intraoperative radiation therapy involves what's called the setup time. In other words, bringing the equipment in, having the radiation therapist there, having the physicist there, bringing the equipment up to the side of the table and positioning the equipment. Then the actual time of the delivery of either electrons or X-ray varies kind of significantly, because with a single fraction of electron intraoperative radiation therapy, it takes around 2 minutes. However, the setup time will run around 15, pushing 20 minutes sometimes. And therefore, the entire time probably averages around 25 minutes. Now, the setup time for the other two technologies from Zoft and Zeiss, or the Intrabeam unit, are a little bit simpler to set up because you're bringing either a balloon or a collimator with a round ball at the end of it into the operative site, tying the tissue around it, which only should take the surgeon a few minutes to do that. However, the actual time to deliver the radiation therapy can run 15 or 20 minutes or sometimes longer. So on average, when we talk about the additional operative time involved with intraoperative radiation therapy, I think as surgeons we figure somewhere in the neighborhood of 25 to 30 minutes. But just think about that. If we can do all of that in an extra 25 or 30 minutes or even 40 minutes, that just saves patients days of radiation therapy that they would get after the surgery is done. I'm convinced that intraoperative radiation therapy in the properly selected patients is going to continue to play a bigger and bigger role in the treatment of breast cancer.
Did you know that not every breast cancer patient needs chemotherapy? In fact, today, there's a way to identify whether or not you'd benefit from that chemotherapy based on the biology of your tumor. To learn more about the Oncotype DX assay and how to discuss the results with your physician, just press this button.